Welcome to our channel. In today's video, we'll explain what is RAAS and how it occurs within our body. Let us jump in. The Renin-Angiotensin-Aldosterone system, RAAS, is a crucial hormonal system in the body that helps regulate blood pressure, fluid balance, and electrolyte levels. It plays a significant role in maintaining homeostasis, or the body's internal balance. Here's how it works. Renin is an enzyme produced and released by the kidneys when they sense low blood pressure or decreased blood flow. Renin acts on a protein called angiotensinogen, which is produced by the liver, and converts it into angiotensin on. Angiotensin I is relatively inactive. Angiotensin I travels through the bloodstream to the lungs where it encounters ACE, an enzyme found primarily in the lungs. ACE converts angiotensin Y into angiotensin II. Angiotensin II is a potent vasoconstrictor, meaning it causes blood vessels to narrow. This narrowing increases blood pressure, which helps restore blood flow to vital organs. Angiotensin II also stimulates the release of aldosterone. Aldosterone is a hormone produced by the adrenal glands located on top of the kidneys. It acts on the kidneys to increase the reabsorption of sodium and water into the bloodstream, while promoting the excretion of potassium and hydrogen ions in the urine. This process helps regulate blood volume and electrolyte balance. Overall, the RAAS helps to regulate blood pressure by increasing it when it's too low and decreasing it when it's too high. However, dysregulation of this system can contribute to conditions like hypertension, high blood pressure, and heart failure. Medications that target components of the RAAS, such as ACE inhibitors, angiotensin II receptor blockers ARBs, and aldosterone antagonists, are commonly used to treat these conditions. A well-regulated Renin-Angiotensin-Aldosterone system, RAAS, is crucial for maintaining homeostasis in the body, and it offers several benefits when functioning properly. The RAAS helps regulate blood pressure by adjusting blood vessel diameter and blood volume. When blood pressure drops, the RAAS stimulates vasoconstriction, narrowing of blood vessels, to increase blood pressure, helping to maintain adequate blood flow to vital organs. The RAAS helps regulate fluid balance by influencing the reabsorption of water and sodium in the kidneys. Aldosterone, a hormone of the RAAS, promotes the retention of sodium and water in the body, which helps maintain blood volume and blood pressure. At the same time, it regulates the excretion of potassium and hydrogen ions, ensuring electrolyte balance. Maintaining organ perfusion. Proper regulation of the RAAS ensures adequate blood flow to essential organs such as the brain, heart, and kidneys. This is critical for their optimal function and overall health. Kidney function. The RAAS plays a role in regulating renal blood flow and glomerular filtration rate, GFR, which are essential for kidney function. Proper functioning of the RAAS helps maintain kidney health and prevents conditions like acute kidney injury or chronic kidney disease. Response to stress. The RAAS is activated in response to various stressors such as low blood pressure, dehydration, or decreased blood flow to the kidneys. Its activation helps the body respond appropriately to these stressors and maintain physiological equilibrium. Endocrine regulation. The RAAS interacts with other hormonal systems in the body, such as the sympathetic nervous system and the natriuretic peptide system, to help regulate blood pressure and fluid balance. Overall, a well-regulated RAAS is essential for maintaining cardiovascular and renal health, electrolyte balance, and overall homeostasis in the body. It ensures that vital physiological functions are adequately supported and helps the body respond effectively to various internal and external challenges. Imbalances in the Renin-Angiotensin-Aldosterone system, RAAS, can lead to various symptoms and medical conditions. These symptoms can vary depending on whether the RAAS is overactive or underactive. Here are some symptoms associated with RAAS imbalances: hypertension, high blood pressure. Persistent high blood pressure is one of the primary symptoms of RAAS overactivity. This can lead to symptoms such as headaches, dizziness, blurred vision, and fatigue. Fluid retention and edema. Excessive activation of the RAAS can lead to fluid retention and edema, swelling, particularly in the lower extremities. This may cause swelling in the feet, ankles, or legs. Electrolyte imbalance. RAAS dysregulation can result in electrolyte imbalances, particularly involving sodium and potassium levels. Symptoms may include muscle weakness, muscle cramps, irregular heartbeats, arrhythmias, and fatigue. Excessive thirst and urination. In some cases of RAAS overactivity, excessive thirst, polydipsia, and urination, polyuria, may occur due to the body's attempt to eliminate excess fluid and maintain electrolyte balance. Kidney dysfunction. RAAS imbalances can contribute to kidney dysfunction, including conditions such as chronic kidney disease, CKD, or nephrotic syndrome. Symptoms may include changes in urine output, foamy urine, fatigue, and swelling. Chronic RAS overactivity can contribute to cardiovascular conditions such as heart failure, coronary artery disease, and stroke. Symptoms may include chest pain, shortness of breath, palpitations, and fatigue. RAS dysregulation can affect other hormonal systems in the body, leading to endocrine disorders such as hyperaldosteronism or primary aldosteronism. Symptoms may include muscle weakness, fatigue, headaches, and high blood pressure. RAS overactivity can contribute to the narrowing of the renal arteries, known as renal artery stenosis. This condition can lead to high blood pressure and impaired kidney function, with symptoms such as uncontrolled hypertension and decreased kidney function. It's essential to note that RAS imbalances can result from various underlying conditions, including kidney disease, heart disease, endocrine disorders, and medication side effects. Proper diagnosis and management by a healthcare professional are necessary to address RAS-related symptoms and underlying causes effectively. Correcting imbalances in the Renin-Angiotensin-Aldosterone system, RAAS, typically involves addressing the underlying cause of the dysregulation. Treatment strategies may vary depending on whether the RAAS is overactive or underactive and the specific condition associated with the imbalance. Here are some general approaches to setting right imbalances in the RAS. ACE inhibitors. These medications block the action of angiotensin-converting enzyme, ACE, which prevents the conversion of angiotensin 1 to angiotensin 2. ACE inhibitors help lower blood pressure and reduce the effects of RAS overactivity. Angiotensin 2 receptor blockers, ARBs. ARBs block the binding of angiotensin 2 to its receptors, preventing its vasoconstrictive effects. ARBs are commonly used to treat hypertension and heart failure. Aldosterone antagonists. These medications block the effects of aldosterone on the kidneys, reducing sodium and water retention. They are often used in the treatment of heart failure and certain kidney conditions. Direct renin inhibitors. These medications directly inhibit the activity of renin, the enzyme responsible for initiating the RAAS cascade. Direct renin inhibitors help lower blood pressure and may be used in hypertensive patients. Diuretics. Diuretics help remove excess fluid from the body by increasing urine output. They are commonly used to treat conditions associated with fluid retention, such as heart failure and edema. Adopting a diet low in sodium and high in potassium-rich foods can help regulate blood pressure and electrolyte balance. Engaging in regular physical activity can help lower blood pressure and improve cardiovascular health. Maintaining a healthy weight can help reduce the risk of hypertension and other cardiovascular conditions associated with RAS imbalances. Stress management techniques such as mindfulness meditation, deep breathing exercises, and yoga can help lower blood pressure and reduce the activation of the RAS. Treating underlying medical conditions such as kidney disease, heart failure, and endocrine disorders is essential for correcting RAS imbalances. This may involve a combination of medications, lifestyle modifications, and other therapeutic interventions tailored to the specific condition. Regular monitoring of blood pressure, kidney function, electrolyte levels, and other relevant parameters is important for assessing treatment efficacy and adjusting therapy as needed. It's important to note that treatment should be individualized based on the underlying cause of the RAAS imbalance and the patient's specific health status. A healthcare professional, such as a primary care physician, cardiologist, nephrologist, or endocrinologist, can provide personalized guidance and management.